would like to ask you, how many of you recently have shared a healthcare story with someone else or with maybe a person in leadership, either elected official? How many of you have shared a story recently, testimony? Could you raise your hands? Okay. Let me say that I know after I was working in healthcare for a few years, my former director, actually, she reminded me, she said, Laura, you're losing your heart. You're talking numbers, you're talking policy words, HHS, and all these different things, and you've really forgotten to talk about what you know best, and that's families and individuals. And so how the importance of the stories, and she's here today, she's smiling, she's laughing, because she knows the difference in how those stories really make a difference. And so, and it takes a little courage sometimes to ask someone to share their story, and also for an individual to share their story. So here today we have someone who has the courage, who has been so inspiring to me, inspiring to all the CBH staff, his willingness to share his story of fighting to trying to get health care. So at this time, I'd like to ask Mr. Will Wilson if he would come up and share his story with you.
All right, good morning. I actually have absolutely no problem standing in front of a microphone. Before I started doing this, I suppose I probably did. I've been an advocate for a very, very, very long time. 30 years ago, I became an advocate for HIV/AIDS. I'm an out gay man. I watched too many of my friends dying from that virus. About 10 years ago, I was diagnosed with AIDS. At the time, I had health insurance. My health insurance didn't cover jack. And within a year and a half, I went into medical bankruptcy to the tune of $175,000. Now, several years ago when our president said, you know, I want to pass healthcare reform, I literally cried, because this was something that, as a person living with HIV and AIDS and getting his healthcare through the Ryan White Care Act, which is a payer of last resort and funded by both the federal government and the state, I'm kind of limited in terms of what I have available to me. And that does cost me. My health care does come through Ryan White, but I'm limited in terms of how much money I can make. So it's not free health care, something I've had to argue with in terms of the health care reform and getting the Affordable Care Act passed, because too many of these people who were opposed to it were like, what's your problem? Why are you complaining about this? You're getting free health care. No, it's not free. I'm paying for it, one way or another. And so are you, because we all pay for it with our tax dollars. So when healthcare reform first started, actually I was down in Millennium Park. I think it was one of the first protests that we were having against Blue Cross Blue Shield. And at the time, one of the interns that was working for CBHC heard me speak. She approached me and said, would you like to be one of our story sharers? And when I first hooked up with Campaign for Better Healthcare and met Kathleen Duffy, I talked with Kathleen and I said, you know, I'm a little reluctant to share my complete story. I'm not sure how people are going to react when I tell them that I'm a person living with AIDS, because there's still a lot of stigma attached to this virus. And to me, healthcare reform was more important, but they do go hand in hand. And so Kathleen's suggestion to me was, when you talk in front of people, tell them that you're living with a chronic long-term condition. And I did that for a while. Until one day I was in front of a group, probably twice this size, and I said, you know what, screw it. You people are gonna hear why I'm up here. And I told them, I'm a man living with AIDS, and this is the reason why. And that has been a big benefit because it helped me become more of who I am. And afterwards, I had 4 people that were in that audience who walked up to me and said, you know what, I'm also living with HIV, and I want to thank you for sharing your story. Now, since I've started doing this, after the Affordable Care Act was passed, again, thanks to CBHC, Mark Brown, the columnist from the Sun-Times, did a column on me. which I was quite flattered to be featured in. And then this past year, the AIDS Foundation of Chicago has nominated me to become a member of their advocacy group called Illinois ASAP, the Alliance for Sound AIDS Policy, a group of 16 of us advocates throughout the state to implement sound AIDS policy on both the local, state, and federal level. And because of that, I was interviewed for an article in the Washington Post. Now, interestingly enough, that Washington Post article led to an interview on Fox and Friends. Now, when they approached me for Fox and Friends, my first question to the producer was, how did you get my phone number? Since I didn't give it to them. And he said to me, well, I'm a producer, that's what I do. So I went to their television studios about a year ago, and Megyn Kelly, charming Megyn Kelly, said to me, this was after the Affordable Care Act had been implemented, the high-risk pools were out there, and I discovered that the high-risk pool that is currently available, I can't afford. The rates, the monthly rates or monthly premiums for the current high-risk pool until the exchange is created is about the same as what I'm paying in rent every month, and I can't afford that. So the Washington Post article compared the state of Illinois with the state of Connecticut, a woman my age in Connecticut whose rates are about half of what mine are here in Illinois. Megyn Kelly was under the impression that I thought the Affordable Care Act was something that was wrong. Well, I had the opportunity to correct her on national television in front of 30 million viewers. And I said to her, she said, so you think the Affordable Care Act is bad legislation? And I said, oh no, if I gave you that impression, I'm sorry. To my way of thinking, the Affordable Care Act is probably some of the best legislation that we have ever passed, and in fact, I don't think it went far enough. So again, the benefits of being able to tell your own story. And I continue to do that. I've since been in a couple of documentaries, so if you go on to Vimeo, you can see a documentary about what it's like to live waiting for the Affordable Care Act to kick in for somebody like me, which will be 2014, provided our state gets that insurance exchange put together, so that I can get off of Ryan White and get out of ADAP. Because folks, I have to tell you, I actually spent yesterday in tears because of our economy. Many of the ADAP programs across the United States have been short funded. There are now 7,000 people on a waiting list for life-saving drugs. And if you don't fill out your forms appropriately within the right amount of time, you actually get dropped. And they don't like to announce this here in the state of Illinois, but we do have a waiting list of about 80 people. And because my forms had not been filled out correctly, unknown to me, I had been dropped. And I found out inadvertently by calling the pharmacy that they weren't going to refill my prescription. So imagine my fear thinking that as of this Saturday, I would no longer have life-saving drugs. Because I've learned how to tell my story, because I've met politicians, because I know folks like the Campaign for Better Healthcare, I know who to call. I know what kind of things, what kind of noise to make. So fortunately, I was able to get it resolved, and my meds will come before the end of this week, knock on wood. I'm very grateful for that. But again, this is why we need you. One of the things that Jim did ask me to point out is on your tables, you guys all have these little cards for donations to the Campaign for Better Healthcare. And for every dollar that you donate today, whether it's $1, $10, $100, or $1,000, it is going to be matched penny by penny with the Nathan Cummings Foundation. So any money that you donate will be matched in full by Nathan's Cummings Foundation. So please, give generously. Help folks like me tell our stories so that we can get this all together. I mean, 2014 is only a year away, 13 months. We still have an awful lot of work to do within the next 13 months. And I can't tell my story without your support. So I do thank you so very much.